Okay. Hello, everyone. Thank you very much for joining today's Network Mind Out webinar. My name is Sally Morris. I'm the National Mind Out Project Coordinator at the National LGBTI Health Alliance. And today I have with me Brydie Jameson from Every Mind, who is going to be talking about how do we talk about suicide and mental health, in particularly within the LGBTI communities. Before we kick off and hand over to Brydie, I'd just like to acknowledge the traditional owners on the land on which we are all gathering today, and pay our respects to elders past, present, and to any Aboriginal or Torres Strait Islander people joining us here today. So thank you. So I've been working with Brydie and Every Mind for quite a few years now, and saw Brydie make a similar presentation as she's making today at the Health and Difference Conference in Sydney. And I think this is a really particularly important conversation for us to be having as an LGBTI sector and in communities, given the rates of mental poor health and suicide in our communities. So Brydie is a project officer in the suicide prevention team and is connected with the Mindframe project. But I might let Brydie introduce herself in more depth and a bit more about her work. So how today's going to be working is Brydie's going to give her presentation, and if any participants have any questions or comments for Brydie, please type them in the chat box. There is a chat box where you can type your questions. You can type questions throughout, but primarily we're going to be answering questions at the end of today's webinar, which makes it just flow a little bit more smoothly. So if you have any questions for Brydie, please just type them in the chat box there. Today's webinar has also been recorded and will be made available on the National LGBTI Health Alliance's website, likely from early next week, and is able to be shared broadly with people who weren't able to participate today. So thank you, Brydie. I'm going to hand over to you to introduce yourself and to take us through this really interesting topic. So thank you.
Thanks so much, Sally, for that introduction. I'm really excited to be here today, and I too would like to acknowledge the traditional owners, particularly on the land that I am presenting to you from today, the land of the Awabakal people, and I would like to pay my respects to elders past, present and emerging. I'd also really like to acknowledge the voice and the contribution of people with lived experience of suicide or mental ill health in all the work that we carry out here at Every Mind and into the broader sector as well. Before I start today, I just want to say that I will be discussing the topic of suicide in this presentation, and if just a reminder that it may be distressing for some people, and that if it isn't distressing for you now, it may be in a few days. And I just wanted to remind people to sort of reach out for help, and I will be providing a little bit of self-care and helpline information throughout the presentation. So as Sally said, I work at an organisation called Every Mind. We're based in Newcastle, New South Wales, but most of the programs that we work on are national programs. I primarily work on the Mindframe program, and I'm a senior project officer within that team. Over the last sort of 12 months, I have been working mostly on a new project called Mindframe for alcohol and other drugs, and that's supporting the media as well as other key stakeholders to communicate about issues related to alcohol and other drugs safely. I work with Sally as well in terms of I'm the LGBTI Mind Out champion for our organisation. And I have had the opportunity, it was 2018 last year, to attend and present a similar presentation to this at the Health and Difference Conference. So I'm just going to get the presentation underway. So as I mentioned before, Everymind is a leading national institute, and we are dedicated to reducing mental ill health, reducing suicide, and improving wellbeing for all Australians. And we've been doing this work for about 25 years. So if Everymind doesn't really ring a bell, we used to be called the Hunter Institute of Mental Health. And a couple of years ago, we rebranded to be Everymind because the Hunter is sort of an area near Newcastle, and it didn't really encompass the work that we were doing. So just a bit of a session overview. I'm going to introduce you into what Mindframe actually is. I'll talk about impact of media reporting and communication about suicide and mental illness. I'll touch a little bit on working with the media as a person who is sort of an expert in terms of your field, a little bit on social media, some self-care, and there'll be questions at the end. So what is Mindframe? So Mindframe is a program that is managed by Everymind, and we collaborate with the Australian media as well as other sectors, particularly the health sector or any relevant sector, to encourage responsible, accurate and sensitive portrayals of mental ill health and suicide. So we do this by providing leadership within our sector, build capabilities of the sector, so by doing stuff like we're doing now, as well as other stakeholders. We prepare and we disseminate education resources and information. We increase research to support the evidence base. So this program is an evidence-informed program, and we invest in our organisation and people. So there's a little bit of a rumour out there, particularly around the media, that because of particular guidelines and because of particular, sort of evidence base there, that the media should not be covering issues related to suicide. However, suicide and mental illness are legitimate issues to be covered by the media, and the media plays a very sort of important role in terms of providing information around suicide prevention and suicide and mental illness as a public health issue. So Mindframe does not suggest that the media should refrain from covering suicide. However, the media and any media sources and anyone communicating with the media need to be aware of the potential impact of covering suicide. And we're going to talk about how we are able to sort of do that in a safe way. So Mindframe interacts with a lot of different stakeholders. So we interact with the tertiary education system. So we work with media and journalism students and public relations students to build their capacity before they enter the workforce on how to report and communicate about suicide and mental illness safely. We also go into newsrooms and we do training to continue to remind people and journalists on how to report safely and communicate safely on suicide and mental illness. We also work on fictional portrayal. So we've had a lot of involvement recently with Netflix Australia on the release of a lot of their pieces and films and seasons that contain information around mental ill health and suicide, particularly problematic content, as well as some stuff that can result in stigma. And then over here, we work closely with media sources. And so that would be a lot of the people that are listening into this webinar today. So people in the suicide prevention and mental illness and alcohol and other drug sectors, people with lived experience, police and court is a really big stakeholder for us. People that are developing campaigns, community groups, and other health professionals. So the result of this sort of methodology is that hopefully we'll have improved communication and media coverage of suicide, mental ill health, and AOD issues in Australia. So is it working? So we go, as you see before, it's quite an extensive way in which we go out and we do a lot of training and a lot of capacity building across the country. So is this process actually working? The answer is yes. So in 2000 to 2001, the University of Melbourne carried out a media monitoring project, and what happened was that they, over 2 12-month periods, they collected media, so from newspaper, TV, and radio items on suicide, mental health, and mental illness over 2 12-month periods, so 2000 to 2001 and 2006 to 2007. So in 2001 to 2000 to 2001, there was almost close to 5,000 items that were found, and then that were identified by this media monitoring study. Then in 2006 to 2007, there was almost double the amount of articles found. So that kind of debunks that myth. So the Mindframe guidelines came into play around 2002. So that kind of debunks that myth that because of these guidelines, people aren't reporting on suicide and mental illness. What that is kind of demonstrating is that people now feel like they have the capacity and the understanding to report on these issues safely. And then in terms of quality, so from 2000 to 2001, against the Mindframe guidelines, the quality of reporting was at about 57.1%. When Mindframe rolled out its dissemination plan, which included this model of going out and working with these key stakeholders to build capacity around and understanding around the Mindframe guidelines, we then saw a increase in total quality scores in the next media monitoring study. So it is working. People are understanding the guidelines, and people are now feeling like they have the confidence to utilise those guidelines in the work that they're doing. So what's the role of media sources? What's the role of, majority of the people on here today, I would assume, work in health, or they work in, or they're within the LGBTI sector, or they work in the mental health and suicide prevention sector. So you're a really important source of information for media professionals reporting on suicide and mental health. And you also, some of this information will just provide you with the skills to be able to communicate, if you're creating, communicate about these issues safely. So if you're creating particular communication content that is being distributed within your organisation, or it is going out as an internal document, referring back to these guidelines will provide you the opportunity and the capacity to be able to make that document and that information safe. We also have a critical role in raising the media's awareness of the guidelines for reporting on suicide and mental health. So say if you're in a situation where you've been asked to comment as an expert in your field, and it's around suicide or mental illness of a particular person or a particular issue, have a critical role in saying, hey, I think it's really great that you're reporting on this issue. However, I just want to make sure that you are reporting within the Mindframe guidelines, and providing that opportunity for the media or for that reporter to engage with us if they need to. So when we're talking about suicide, it's important to know the most reliable and current information. And how much do we know about current rates of suicide in Australia? So each year, Mindframe works with the Australian Bureau of Statistics to deliver its its causes of death data related to intentional death caused by intentional self-harm. And we make sure that these are delivered with context and in a safe way as well. I'm sure you're aware that the last release of rates, we actually saw a slight increase in deaths from 2016 to 2017, which we're not quite sure why that has occurred, but it did occur. So if you are working in the LGBTI sector, and I have many conversations with Sally about this, that it is important to acknowledge that statistics relating to suicide and mental illness in LGBTI communities are not routinely collected. And I know that the LGBTI Health Alliance are working very hard at the moment to try and have that changed and have some information and some statistical information around that collected. However, while there is currently no population-based data on completed suicides by LGBTI people in Australia, recent research has indicated that mental ill health, self-harm, suicide attempt and suicidal ideation rates within these communities are disproportionately higher to other Australians. So for this reason, it is really important that one, that this issue is highlighted, but also that it is highlighted in a safe way. And if you are working within that LGBTI sector, having that understanding of how to communicate about suicide safely is really important. So why do we need to consider? So reporting inaccurate or negative information about mental illness promotes stigma, perpetuates negative, inaccurate beliefs about mental illness. And what the evidence actually shows is that no matter how much we sort of talk about mental illness and mental health in a positive light, it doesn't actually have a difference on that negative conversation as well. So it's really important to just completely take away that negative conversation and just sort of talk about it in an accurate way. As mentioned before, LGBTI Australians have disproportionate experience of mental health problems and mental illness, as well as higher rates of suicide. And the 5th National Mental Health Plan identifies that it is a priority to reduce stigma and improve the appropriateness of mental health services is critical for LGBTI communities. So the impact of media reporting on suicide. So reporting about suicide death has been associated with increased rates of suicide and suicide attempts using the same method or location, and increased rates of suicide overall. So I'll talk a little bit about method and location soon. People vulnerable to suicides may be drawn to stories about suicide and negatively impacted by these. So I just want to focus on that for a little bit. So when we are talking about communicating or reporting on suicide, particularly, what Mindframe does is we're protecting the vulnerable people. We're protecting it. It is a very small population, but we're protecting people that are particularly vulnerable to suicide. And in terms of, the fact that we were just talking before about the LGBTI communities have disproportionate rates of suicide to other Australians, that would be identifying and suggesting that then also is a particularly vulnerable population. So when we are talking about this content and who it's affecting, it's people who are vulnerable to suicide. And, if you are well and you aren't vulnerable to suicide, you don't have suicide ideation, you might see this content and it not affect you at all. So it's really important to sort of remember that. And when people, I guess, maybe don't understand the need for such guidelines because it hasn't impacted them particularly, that's the bit of information that we give them and we pass on, saying, it might not affect you, but are you vulnerable to suicide? You might not be, so therefore it might not affect you. So risk generally increases when communicating or reporting details of method and location. The suicide is sensationalised, or the concept of suicide is sensationalised, is prominent and repeated. So if there's been a suicide that has occurred, particularly around celebrities or a prominent figure, if it's continually sort of, the media is just full of information on that particular suicide. Focuses on an individual who has died, especially celebrities, or if someone identifies with that person. So in this situation, particularly with the LGBTI community, if someone's significant within the LGBTI community that people to identify with, that's also a risk factor. Or glamorize or glorifies the death. So Mindframe principles for communicating about suicide. So the media, as well as media sources, have a role to play in raising awareness of suicide as a public health issue and prevention behaviour. So to decrease risk, it may be helpful to avoid linking sexuality, gender identity, or intersex characteristics to suicide. The reason for this is that suicide is rarely the result of one single factor, and making and linking it to one single factor can be quite dangerous for people who are vulnerable, who may be also experiencing that particular similarity to the person who has taken their own life. So it's important to really highlight that, if you are going to mention someone's sexuality, it probably really isn't, necessary. But if that does need to be mentioned, then it isn't sort of linked to the particular, to the suicide. Link journalists and stakeholders with experts. So, for example, if someone comes to Mindframe and they're reporting on a topic related to mental illness or suicide within the LGBTI community, I'll always reach out and put them in contact with Sally from Mind Out. And if there's someone that Sally thinks is, sort of better suited to talking to the issue or commenting on the issue or contributing to that piece of work, she'll put us in touch with them as well. So really making sure that the right experts and the right stakeholders are involved in the development of that communication. Modify or remove information that may increase risk. Choose appropriate language and avoid details of method and location. So here's just a little language card. We have this on our new Mindframe website. I'm not going to go through all of them today, but the main one that does pop up that is really common, and I will just sort of speak to it a bit, is associating suicide with crime or sin. Now, it's becoming less and less, but we'll still see the use of committed suicide. This can be quite stigmatizing for someone who has either made an attempt on their life or has lost someone to suicide. Or has suicidal ideation. So sort of preferred language is took their own life. So when you are preparing sort of any kind of communications, or you're working with the media regarding something related to suicide, this is available on our website, and or it'll be available in the webinar now, and you can sort of go to that piece of language, that language card, and if you're sort of seeing any kind of information here about that may be problematic content, you can sort of have a look at the issue and flick over and just use one of these preferred pieces of language to help you with that piece of communications, or even when you're discussing it. I know that people outside of the sector, my peers that I interact with, they always say committed suicide, and I just will try to always use took their own life or died by suicide. If I am speaking to anyone, just to try and get them to maybe copy my behaviour and copy my words. So this is a really important part when talking about an issue of suicide. So I'm going to go through this information. This is also available on our website, which I'll provide a link for you at the end of the webinar. And all this information is also on there as well. So if you're ever preparing anything, you can go there to have a look. So reporting explicit detail about method. So method is what was used for the person to take their own life, has been linked to increases in use of that method and overall suicide rates. So if it's important to mention method, discuss it in general terms. So mix of drugs instead of detail the type and quantity. The reason for this is someone who is experiencing suicidal ideation or wants to take their own life, they have the cognitive sort of level while they're in that state of about a 9-year-old in terms of decision making. And so if they are given information that is particular, that they know is a method that has worked for someone else, they can potentially look at that and go, okay, well, this is a how-to on how I can take my own life. And so putting that information out into the public for vulnerable people is particularly dangerous. So that is really important. There's options there that can provide you with options of how to sort of talk about it. Reporting uncommon or new methods of suicide can lead to imitation as well as lasting impacts on rates. So remove specific details about new or unusual methods of suicide and references to ways further information can be. So for example, online, there might be, working in the sector, you might sort of come across some particular things that are online around particular unusual ways in which people are taking their own lives. So minimising that information is really important. Describing locations of suicide may promote these places to vulnerable people and increase frequency of attempts at these sites. So referring to a location, describe it in general terms only. So for example, if someone has taken their life in, Sydney CBD, just say, a nearby park in Sydney CBD instead of the exact location. Images or footage depicting method or location of a suicide can lead to imitation by vulnerable people. So avoid using detail or dramatic photographs or footage. So for example, don't include, people standing on ledges or implements used in a suicide attempt. So we'll often, sometimes we'll see in stories just like random, nooses or, people standing on ledges. And sometimes we've even seen them in prevention campaigns as well. And people sort of don't have an understanding. So we don't really need to include that information. We can have a successful suicide prevention campaign without detailing those images and that particular footage. So it's really important to place the story in context. So provide information about suicide and its relationship to known risk factors. As I said before, avoid simplistic explanations that suggest suicide might be the result of a single factor or event. Provide suicide prevention information. Discuss current trends with context and with supporting information. So it's really important, if you are using statistics, to really make sure that you're using them in context. And I think also balance it out with an expert input is really good as well. So discuss alternative approaches to suicide prevention. So for example, there may be a story about someone who either did make an attempt on their life, but then was then lived through that attempt and is now gone on to live a great prosperous life. Or someone that did have suicidal ideation, and how they were, able to overcome that, what strategies they used to overcome that, to, convey that, if you are having feelings or emotions or distressing thoughts of suicide, that, if you do, take action or seek help, that there is, that this is the potential outcome for you. So there's really those messages of hope. When we're talking about suicide, we often hear it so much, that it's doom and gloom, and that's sort of for people who are experiencing distress and do have suicidal ideation, it's not a very nice message of hope. And then one of our other key strategies is to always include help-seeking information. I'm sure you've all seen Lifeline at the bottom of media reporting over the years, and that has been the work of Mindframe, working with the media as well as other organisations that have that information. One of the key things though is that as services have developed over the years and there's more specific services available, we do encourage media as well as other people creating content or communication collateral, that they make sure that the help-seeking information is specific to the audience or the people or population that are spoken about in the piece of communication. The other thing to remember as well, that people who are reading this information, they might not always be in a crisis. So providing some alternative information and alternative resources, such as, SANE online forums or Head to Health or reachout.com. So in terms of, so for example, if you were doing a bit of information on some communications that related to the LGBTI community around particularly mental illness or suicide, we'd always be recommending that you include QLife. But because QLife, I think it's only available from 3 p.m. till 12 a.m., we'd always be making sure that they need to include that information on the operation hours, and then also including a 24/7 callback service, just to make sure, because the last thing we want is people calling and not being able to get through. So the impact of media reporting on mental illness. So I've spoken a little bit about this before, but I'm just going to go through it in a little bit more detail. So reporting inaccurate or negative information about mental illness promotes stigma, as I'm sure you're all aware, perpetuates negative and inaccurate beliefs about mental illness. And as I said before, positive reporting does not appear to balance out the negative media portrayals. So it's really important when it comes to mental illness that we are just focusing on accuracies and not, perpetuating myths or negative stereotypes, which I'm sure I am preaching to the converted here about this anyway. So stories about mental illness can inform and reduce stigma by providing accurate information, promoting help-seeking information. So once I said before, people who are experiencing mental ill health, they may not necessarily be in a crisis, but they may want one of those other resource options that they can access a little bit of information. Use appropriate language, share stories of people who've lived experience of mental illness, and avoid negative stereotypes. So once again, here is some language regarding mental illness. I won't go through these all, but one that I really do think is really important. So labeling, this one, terminology that suggests a lack of quality of life for people with mental illness. I think it's 1 in 4 Australians will experience, mental ill health within a 12-month period. So, if everyone that was experiencing mental illness was perceived as a victim or suffering from or afflicted, referring to someone in this way can be quite stigmatizing, and it's kind of, as I said, as it says there, it kind of sort of perpetuates this concept that because you have mental illness that you have a poorer quality of life, when that those statistics on people experiencing mental ill health, it just simply can't be the case. So a person is being treated, or someone with a particular mental illness, or if you're, or that person experiences, anxiety, that person has depression. And the other one as well is labeling a person by their mental illness. A person is a schizophrenic or an anorexic. It's very stigmatizing. You're more than just your mental illness. You're more than your diagnosis. If you have a broken foot, you're not a broken foot. I don't know. It doesn't even make sense. But a person has a diagnosis of or has been treated for schizophrenia. To be mindful of reinforcing stereotypes. So this is just some myths and some facts. So I'm sure there's, this information is you're probably already aware, but I think these ones too that I'd like to point out that are really important are people are unable to recover from mental illness. However, that mental illness is not a life sentence. Most people will recover completely and go on to live full and productive lives. And there's various treatments available to engage people to manage symptoms and their illness. People with a mental illness differ in appearance in others in the community. People with mental illness do not look any different from other people in the community, and you can't tell someone has a mental illness just by looking at them. So this is just an example of a article, a Fairfax article. that I just highlighted some sort of information that was potentially problematic or just needed a bit of consideration during the marriage equality vote. So here, overall, it was a positive article, but there was some parts that needed to sort of be addressed, and there wasn't sort of any kind of help seeking provided at the bottom of this article as well. So just this highlight a bit, the study that 92% of same-sex children in same-sex homes are abused are considered incorrect. So even though the information is saying it's incorrect, that's quite confronting information that is being reiterated or being communicated there. So, that could be quite triggering for some people. And, I guess having, if you were the journalist, I guess having sort of an understanding and maybe saying, do I need to include this information? Or if I do include this information, is there specific stuff, help-seeking information that I need to include there? Once again, so just sort of this language around, psychological or poorer health outcomes, even though the AMA is saying that it's inaccurate, it's still information that's being conveyed that, it was going around during this time. And then this one as well, the AMA declared the campaign against same-sex marriage a public health issue rather than an issue of political correctness due to the elevated rates of suicide, up to 14 times higher in the LGBTQI community, caused by public stigmatization, rejection and abuse. So this is quite specific information around, suicide and risks of suicide for people within the LGBTI community. So I'll, be having a sort of, if I was the journo, having a look and going, could this be written in a safer way? Is there, a way that we can convey this information that is a little bit more digestible and will protect vulnerable people, especially during this time? I won't go through the last one, but, providing, there wasn't any help-seeking information, and there's some really significant information in this piece of work that could potentially cause harm to vulnerable people. So when you're working with the media, so if you are working in the suicide prevention sector or in the LGBTI sector, there's an opportunity for you as expert to, promote and work in that suicide prevention space and utilising the media to support you to do so. So promotion, so organisation and activities. If there's any kind of particular activities that you're doing within that space, utilising the media to be able to communicate and convey those things. So, but it is really important that if you are going to do these, to be making sure that they are done in a safe way. I've recently seen a really great suicide prevention and mental health campaign or sort of promotion activity be conveyed in a really, really dangerous way. And it was a really, really great activity. However, the way that the media kind of took it and reported on it then made it really dangerous, which was a really big shame, because the activity itself and the initiative of the group itself was really, really great and really, really important. So promote those activities, but make sure you're doing it in a safe way, and always check that the person that you are working with is aware of the Mindframe guidelines, and also, make sure they, we're happy to take any correspondence or any kind of collateral and review it before it goes public as well. So make sure you're always providing help-seeking information. That help-seeking card that I showed earlier is available on our website for download, and that can be used in any kind of collateral. Remember the Mindframe principles, and information provision, suicide prevention, mental health and wellbeing, and mental illness. So helpful messaging. So in that sort of, prevention space, has the ability to improve community understanding, correct myths and stereotypes, reduce the fear, shame and stigma associated with suicide and mental illness, increase understanding of the challenges experienced by some with a mental illness or caring for someone with a mental illness, and encourage people to seek help. So your role in suicide prevention and working in this space: promote better understanding of issues that contribute to suicide and depression, reduce stigma and promotes help-seeking behaviour, with the outcome being to intervene early and help reduce suicide rates. So it is 2019, and we know that traditional media is it's not the only source of media these days. So what about social media? So we've seen that while potentially harmful information can spread quite quickly on social media, it can also be helpful information. So Mindframe has a media strategy for managing high-profile stories and supporting national campaigns. And so our when a suicide does occur, and if Mindframe is responding to it, we will always make sure that we have a response via, particularly Twitter is the biggest one, especially for journalists. We'll also always make sure that there is communications and information and ways on how to communicate the story and to report on the story delivered via social media. So following the death of Robin Williams in 2014, Australia reported on this really, really well. And our website received 4,000 visits in 3 days. And 25% of those visits came via social media, and 90% of that was via Twitter. So as I mentioned before, social media, things can be shared so quickly, and it's really sort of hard to, I guess, to have control over that space at the moment. But this is just an example. So experts concerned Gina You're Free Williams tweet is dangerous and will cause copycat suicide. So obviously the connection is that Robin Williams was the voice of the genie in the Aladdin movie, and the tweet that kind of went viral was that now Robin Williams is free from whatever he was experiencing, and that encouraged him to take his own life. It's a really dangerous message to kind of send out, that if you are experiencing something, that the only way out is to take your own life. And so this is just an article on why it is an issue, and that it can lead to copycat suicides and that issue of contagion. So Mindframe has developed some social media guidelines, and they are due to come out this year. Our targeted workforces include Australian professionals, media and communication practitioners, and our own sector. And the guidelines will include safe and effective promotion of online engagement, duty of care, suicide prevention, mental health promotion messaging, other Mindframe principles, and moderation of closed and open forums. So that's a really big one. We also have an app, which is the easiest way to sort of get some of our information. It is on our old branding, so we do need to update it. So sort of at the moment, that, if you are sort of struggling with that, our website is also really easy to use on a mobile form as well. And I just want to practice what I preach here in Mindframe, and I really want to encourage anyone who may have found any of the content kind of distressing today to make sure that you talk to someone you trust, or to contact a service, one of our fabulous services in Australia. There's information there below. And I did promise you our website, and that is not our current website. I'm going to get in trouble for that. So from our communications team. Mindframe. Yes, so sorry, our website now is Mindframe, www.mindframe.org.au. And I'll just quickly open that up for you. And that's sort of what our website looks like. And if you go to the suicide section, communicating about suicide, and mental ill health, communicating about mental ill health, and that has a whole bunch of resources and information there for you. And that is all. Thank you.
Thank you so much, Brydie. I really like the running on the fly at the end with updating your details. That's great. It shows the real life experience of doing community work sometimes.
Yeah.
There were a few people who posted some questions throughout, so I'm just going to read them out to you, Brydie, and if you can reflect on those as well. So Sarah has asked actually whether you also work with the AFL.
That is interesting. So Sarah, our project lead for Mindframe, is actually in discussions with the AFL at the moment, and is meeting with the AFL on Wednesday regarding Mindframe and communicating about this stuff.
Yeah, awesome. Thank you. Tom has asked, what are some examples of positive content for conversations around suicide?
Yeah. So in terms of what would sort of say, a big thing is, I think it's really important that we talk about suicide. We don't just talk about suicide when the suicide occurs. These are important discussions that can be occurring on a regular basis, and there is some great opportunities around suicide prevention to give to sort of highlight. So, for example, the Are You OK work that is done. Having if you're doing a particular activity in your area, really highlighting that piece of work that you're doing in your particular area. So making it a suicide prevention campaign, as opposed to saying, someone took their own life, this is how they took their own life, how awful. So actually, and really encouraging that help-seeking information as well. Another one is stories about people with lived experience can be really sort of positive as well. If it's someone who has taken their own life, or someone who has a loved one has taken their own life, and communicate the ways in which they were supported during that process, or how they did make an attempt on their life and is going on to now lead a very fulfilling life.
Great. Sorry, I'm just hoping, can people just, I'm sorry, I'm not sure. I'm trying to share the screen to show the Q Life contact details.
Yeah, it's up there.
Yep, you can see that there?
Yeah.
Great, cool, excellent. No worries. Just want to make sure that that was working okay at your end. Great. Question from Penelope. Earlier in your presentation, you used the term completed suicide, which from my experience in the field is also incorrect language, as it implies success of suicide. What are your reflections on that, Brydie?
Yeah, I actually was having a think about this, Penelope, and I would agree with you. That is my oversight, and I think that what has happened is I've pulled that from a thing regarding statistics, and yeah, I would recommend not using it.
Great.
Thanks for pulling me up on that, Penelope. Appreciate it.
And I think that's one of the really important things that we do across all of our sectors, both in mental health, suicide prevention, but also in the LGBTI space, is that we're constantly adapting and refining and reflecting upon our language. And this is an ongoing process that we all need to engage in continuously. And I think it's really helpful sometimes to ask these questions about, okay, we've used this word or this language, why or how, and when it does change, to have these conversations about why is this term not helpful. So I think it's really great as a sector for us to be engaging in these conversations and to do that pondering about what's best or what's not best.
I couldn't agree more. And I think what I've found from working in this space and is that people aren't out to hurt people or have ill intentions. Often it is they just don't know. And so providing people with that information or having those conversations can really sort of, I think, empower people to have that information and that level, like it's knowledge sharing. So could not agree more.
Yeah, awesome. Thank you. Tom also has another question. Some experts are advocating a change in language by replacing stigma with unlawful discrimination. What are your thoughts on that?
Yeah, I have. That has come up, not too much, but recently, but it has been spoken about. I think it's, as Sally said before, language is something that's constantly developing and something that may be stigma may be seen as inaccurate or discriminatory or isolating or hurtful, in one area or in one time, may not be in another time. So I think it's really important to continue to have those conversations and to have that discussion. And if it is determined that that is the better use to be inclusive and to support people who are experiencing either unlawful discrimination or stigma associated with a particular thing or issue, that is what is used, and we continue to have that discussion.
Yeah, great. Yeah, so Tom also reflects here, it's nice to support each other with language and concepts in both mental health and LGBTI, plus it takes time to improve. So I think that's great. And personally, these are conversations I really enjoy having conversations about, because I think language is never static. And there is a bit of this mirror process, I think, happening in the mental health space and also in the LGBTI space, where we're constantly evolving. So just seeing if there's any other questions that people have for Brydie, if they want to type it in the little chat box there, that will pop up. But I do want to take the time to thank you, Brydie, for your time and reflection. It's been really great being working with Every Mind and Mindframe over the last several years. Particularly in a space where we do that double-edged sword of stigma, stigma towards both mental illness and suicide, but also the stigma towards our LGBTI communities. So I think it is a really important place for us to be at the forefront. And as you said, the people watching today's webinar are often the experts called upon to provide the content to the media the number of times. I know that the Alliance will be contacted by media who are just looking for that quick comment on, usually the stats and facts, what's the number of LGBTI people who die by suicide, and sometimes to slow them down and to give them more accurate information rather than that really quick soundbite that they're really looking for. It can be difficult because journalists can be quite demanding in those times as well. They have really quick deadlines. They go, we want something right now. And sometimes to put the brakes on and go, it's important that we provide accurate information, more so than just simply providing information.
100%. And that's the thing. We often have conversations with journalists of, deadline will often be an issue, and we'll sort of have that conversation of, this is a really important issue, and we need to be making sure that this is reported on, correctly and safely. Do you want to have a think about whether that deadline, is actually a big factor, or do we want to work through this and, you print another story for that deadline? Another thing as well is that whole concept of, sensationalizing things and to sell paper. More than happy for people to sensationalize things, but my number one thing is don't do it with suicide or mental illness, and definitely don't, or just health issues in general. I think it's really unethical, and that's often a conversation that I'll usually not necessarily with journos. Usually we'll just try and get the information taken out what is in there when we're in kind of production or post-production phase. But when I'm working with journalism students, particularly, just saying, there will come a time when your editor is encouraging you to sort of take that unethical kind of, stance, and you've got to make a decision on whether you sort of do that or not. And there's guidelines here for a reason.
Yeah, awesome. Thank you so much. And just to end with that, another plug of Q Life, so they're available 3 p.m. to midnight, 1-800-184-527.
Yeah.
Or there's online chat at qlife.org.au. And this is a service that's available not just to LGBTI community members, but also to people working in the LGBTI space, also people who are looking for access to referrals, who you might be working with LGBTI people. So really encourage people to use that service and to refer people you're working with to that service as well. It's marvellous. It's got a great national database of local LGBTI services you can tap into. So thank you very much, Brydie. I really appreciate the conversation today. Just to remind people that today's webinar has been recorded and will be made available on the Alliance's website in the coming days. So thank you very much, and I look forward to seeing you all next month for our next webinar. So thank you very much. Thank you.